Well, good morning or good afternoon, depending on where you are, or maybe good evening. But I'm Gustavo Tolosa, the webinar coordinator for Dr. McDougall, and here we are again on a Thursday in the month of September, and Dr. McDougall is joining us from Santa Rosa, California. I'm in Dallas, back in Dallas, Texas, after having had a great, amazing weekend for the Advanced Study Weekend in Santa Rosa, California. And very excited to have come back with a copy of the new book that Dr. McDougall has out. How are you doing, Dr. McDougall? What are you doing today?
Well, let's see. Today's Thursday. We finished all that on Sunday. I have to say,
yeah.
They say life goes faster as you get older. I don't know what happened. I mean, I just saw you a minute ago live in Santa Rosa. It was, and that was probably the fastest weekend that I've ever spent, from Friday until Sunday with the Advanced Study Weekend. So I'm glad you're home safe, and you actually had a few minutes of stardom there, Gustavo, on the Advanced Study Weekend.
Yeah. Yes, it was very, very fun. And like you said, I mean, the weekend goes so fast because there's so much activity and it's so exciting. So it flies by very fast.
As I say, every time we start an Advanced Study Weekend, I say, I cannot imagine how this is going to work. And I did something particularly different this past time than I'd ever done before. But as you know, I'm not a person that's shy or hesitates to try new things.
No.
So yeah. So what I did this last weekend, and I didn't know how it was going to work out either. So I invited 5 of the future doctors, which would be Tom Campbell, Craig McDougall, Anthony Lim, who's our medical director, Matt Letterman, and Alona Paldi. I invited the 5 of them to be on stage to tell us how their individual practices are going. And that means taking care of a Zoom Prime or Zoom Care up in Portland, which my son is doing. Anthony Lim, I think, was the happiest of all of them because he's working at the McDougall Live-In program where people do as they're told. And Letterman and Paldi, they're helping Whole Foods develop a national medical system based upon whole foods. Then we have Tom Campbell, who's doing some amazing things on the East Coast in terms of Campbell Foundation, T. Colin Campbell, as well as his general practice. But I heard from all of these young men and women that they're very frustrated because people aren't making obvious, necessary changes. And I could relate to them. I told them I've been doing this for 40 years, and I understand their frustration. The nice thing is now in Santa Rosa, really, I get to lock them up. I get to put them in jail and make them do it. And that's very rewarding, not just personally as a doctor, and Dr. Anthony Lim gets that same satisfaction, but it's financially rewarding. And I told the young doctors this, and because they're very frustrated. They're trying to raise young families and make a decent living, and they watch the heart surgeons make $500,000 a year, and the oncologists, they make a similar amount doing the wrong thing, hurting people. And they say to themselves, how can I continue to do the right thing? And I turned around on stage late Saturday afternoon. I looked them all in the eye and I said, look, gentlemen and lady, and everybody else listening out there that wants to do the right thing. As I said, if you have $100 billion to tap into the heart business, that's $100 billion sitting there that you get to compete for in terms of catheterizations and bypass surgery. That's your money. You can get that doing the right thing, $100 billion. And, the oncology business has to be at least that much. And I was just looking at the cost of multiple sclerosis drugs today in the medical letter, which I get probably every 2 weeks, the medical letter, great document on drug therapy. And I was looking at the cost of MS drugs, and they're $75,000 to $85,000 just for the medication a year. And young men and women who are out to do the right thing, that's your money. That's yours to get and compete for. So it was an amazing evening. Late afternoon, not only did we have those 4 young doctors, but we had 4 older dads there.
Right.
K.B. Lim, T. Colin Campbell, Steve Letterman, and myself. And I have to say, anybody who saw that afternoon and that late afternoon presentation, it was well worth the money you ever spent on any Advanced Study Weekend. It was an amazing experience. So that was good. We had Dean Ornish there, who was at his best.
Oh, yes. Yeah. Incredible. You know,
And,
what one of the things that I really enjoyed and thankful you did with the 5 young doctors was to see that there is hope, because I know that not only me but everybody here in the webinar, sometimes we wonder what's going to happen when you are gone with Dr. Campbell. I mean, we're all going to die sooner or later, and you know, these doctors are there to take over.
they are they are there. There's Joel Kahn and Garth
Yes,
Davis, and you know, many young doctors that have learned from us, and Alan Goldhammer and Joel Furman and Caldwell Esselstyn and Dean Ornish. I mean, it's been our generation. We're not done yet, so don't think about it that those of you who oppose us or those of you who look for us for guidance, we're not done yet. But that was, I have to say, the highlight of the weekend was to have those young doctors, and yeah, it's pretty amazing. I gave a couple of 3 talks that I really enjoyed giving.
Oh yeah,
and,
yes.
So anyway, it was a good weekend. You missed it if you missed it. If you missed it, you know, I'm really sorry. You can watch it on the internet, and it's almost as good. It'll be up there on the internet for 6 months. It's not free; you can pay for it, but it's believe me, whether you're in China or Russia or Australia, New Zealand, it's well worth your time and trouble to watch it. So it'll be available for 6 months, and then February 10th through 12th, 2017, we have another weekend, which already just the inventory of speakers has to be far better than anyone we've ever done before. So anyway, that was fun. What else did I do? What other kind of shenanigans did I pull this week? I let John Robbins have a say about how wonderful it will be to have this election coming up. And hey, we only lost 70 newsletter subscribers from that one email. Yeah, you know, people come back and they say, well, you're doing politics, McDougall. Well, excuse me, I'm always doing politics. You know, I criticize the egg industry. I criticize the USDA and their dietary guidelines. I criticize the food industry and the pharmaceutical industry. I'm always in politics.
Right.
And you know, it's just part of the business, because if you can't make the evildoers do the right thing because it's the right thing to do, then you need to have government step in and defend us from foreign and domestic threats. You know, foreign threats like our enemies, you know, I'm not going to mention who they are, but you all turn on the news, you know, there are some foreign threats out there with atomic bombs and armies and so on. So it's not IBM or Ford that protects us, or Kraft Food or Harvard University. It's the U.S. government. And likewise, we need the U.S. government to protect us from domestic threats, which are the food, tobacco, drug industries, the hospital industries. You know, so am I involved in politics? You bet I'm involved in politics, because politics is medicine, and medicine is your life. And, you know, it's all intertwined. But the other thing I did, which all of you, everybody applauded, Gustavo, you see, I don't always make people mad. The other thing I did is I invited two of our candidates. They said I should have invited 4 of our candidates, but, you know, let's be real. The only 2 are going to debate coming up here in a week or so. So both of our candidates for presidency have been criticized for their bad health. And what I offered, and sincerely do, I offered to change their life in 7 days, which we have proven to do in our publication, like in the Nutrition Journal, and to improve the life of people, control their health for a year, which we did do in the journal MS and Related Disorders. So we have scientifically proven that we can change the course of this election by changing the course of the candidates. And not only would we invite the 2 primary candidates, we would invite their staff too, so that they could win like gladiators or like marathon runners.
Right.
And so I put the invitation out to both, which made everybody happy, because I was nonpartisan. Now, you don't know whether or not I would accept both when it really got down to it, but let's just say I would. There's no doubt, and I put up our 42nd president, William Jefferson Clinton, as an example. There's absolutely no doubt in anybody's real mind as to whether or not we could change the outcome of this election by giving the health and endurance and strength to one of the candidates, preferably, or both of them if we needed to give them the strength to show this country and the world that we are we are the right stuff. Americans are the right stuff. Now they look at us and they say, you're the fat stuff. You guys, 2/3 of you are overweight and half of you have heart disease. That's not the America that we need to know for the future. We need to know that American strong people. Anyway, that's what we did last week. You and me, Gustavo, and the rest of the McDougall crew, so to speak.
Yes, yes. Well, the food, I have to say, as usual, was outstanding. And I'm always surprised. There's always something new there to try.
Yeah, the food is really good. We had a few people, excuse me, a few folks brought their kicking and screaming, and they even liked the food. So it was delicious. And which brings up one other thing that Mary wants me to mention to you. We had 10 rooms left on the weekend. She sold 2 since the weekend. There are only 8 rooms left for Kauai, Sheraton, which, by the way, is the best food of any of the advanced study weekends we've done in 23 years. And that's why we're going back to the Sheraton in Kauai in January of 2017. So there are 8 rooms left. And this is September, and the end of January is pretty quick. So what do you think? Do you think I should talk about osteoporosis a little bit, or?
Yeah, yes. I think that this is a topic that interests so many people, and so many people are in pain and they have questions, which thank you all for sending questions. I have them here, and we'll try to get to as many as possible. But, Dr. McDougall, I would like to ask you to do something for me and for everybody here. At the beginning of the Advanced Study Weekend, when in your first talk that you did, you described the START solution, or you described the McDougall program in 2 sentences, and I thought it was really good, brilliant. And so since we have new people every time here, it would be good for you to tell us in those 2 sentences what the McDougall way of eating is, the START solution.
Right. We have to, and that's based on 2 quotes that I live by. One is, the truth is simple and easy to understand, and a picture is worth 1,000 words. So saying that, it's simple and easy to understand. The McDougall diet is a starch-based diet with fruits and vegetables. That's 1 sentence. And the second sentence is the McDougall diet does not contain animal foods or oils. Now that's the truth. It's simple and easy to understand. I mean, just those 2 sentences. But if you want the pictures, they're in the new book, and they're also on the website free under Dr. McDougall's Color Picture Book. So, it is so simple. A 5-year-old can understand it. It'll take you 20 minutes to go through the pictures on the website for free. They're in 24 languages. After 40 years of this kind of practice and 50 years in medicine, things get simpler as life goes on.
Very good. Yeah, that was. I think that a lot of people really enjoy hearing you say, just in 1-2 sentences. Yes, very good. Well, tell us a little bit about osteoporosis and what causes it, and if it can be reverted, etc., etc.
Yeah, I think the first thing we have to come out to understand, in a mutual understanding, is osteoporosis is not a normal condition. Your bones, a woman is designed to live for 85 years. And there will be some bias here in terms of gender. We're talking primarily about a woman's disease. And the reason is because men maintain their male hormones a little longer in life than women maintain their female hormones. So a woman will suddenly lose her estrogen support of her bone system at age 50. And a man will continue to have testosterone and other hormone-related support into, say, his late 60s or 70s. So why do you lose your bones at 50? And that's not exactly what happens, but on a superficial cruelty level, you may say, well, God finds no use for women after 50 because they can't have babies, so we raise the risk of heart disease the same as that of men. They become fatter after 50. Their bones are no longer protected because they can't reproduce. And so, well, that's, of course, an incorrect sexist point of view. But there is some truth to it. Now, let me tell you the truth to it, is that your bones do naturally get thinner after 50 in terms of bone mineral density, and in terms of checking the mineral content of the bones. They naturally, normally become lower in mineral content because that's the way it's supposed to work. When you're in your younger years, say you're 28 years old, which is the model that's used as the test for normal. In other words, if you don't compare favorably to a young woman in her reproductive years, say a 28-year-old white female, then you flunk the bone mineral density test. And so you're considered to have thin bones, which is osteopenia, or frank bone disease, which is osteoporosis. But this is the way it's supposed to be. When you're young, you're supposed to be having babies, which you need to grow inside your body, and which you need to feed by your breasts for another 2 years. So you need all this mineral to develop the fetus and to support the growth of the infant. And that mineral is stored in the bones. This is normal, natural. Over 2 pounds is stored naturally in your bones. When you get to be 50, you lose your reproductive capacity. It's called menopause. And not only do you stop producing estrogens or reduce the production of estrogens, but about 10 years later, you stop or reduce the production of testosterone. And what the body does naturally and efficiently, this is efficiency, is the body dumps the extra 2 pounds of minerals it's carrying around because no need, you're not going to have babies. It's a normal, natural thing to do. So if we compare you as a woman, say 70, which is Mary's age, to a woman, say 30, what would you expect but a lower bone mineral density test? It's normal and natural. So you'll flunk it. So as a result, 2/3 of women age 70 beyond are considered to be diseased, to consider to be with osteoporosis or osteopenia. And when you have a disease, you need a drug. So they used to be told to take estrogens. Now they're told to take bisphosphonates and other bone enhancing medications that can be inhaled or injected or swallowed. These drugs are of extremely little benefit, first of all, and second of all, and really the benefit has to be measured in terms of highly manipulative methods that they put together in their drug testing and highly manipulative analyses, and only talking about the relative benefits versus the serious adverse effects of these drugs. So as usual with medications, you're being fooled in the drug company's favor. They always have a little bit of truth, but you're still being fooled. So you get to be 50, you develop thinner bones as you're supposed to. You're frightened to death, as should not be. You should go to the doctor and feel better, not worse. But you're told to get a DEXA scan or some kind of other test that measures the bone density, or maybe in some way the strength of the bones, like ultrasound. And you flunk it, and you feel a lack of confidence in your health. That's one thing that happens. You're worried with every step. You're frightened into drug therapy. And let me tell you how I deal with this. First of all, I think God made a wonderful creation in terms of the female. You know me, Gustavo. Anyway, I'm almost 70, and I still appreciate all of nature. So it's not a mistake in terms of you getting older. You're supposed to get older. You're supposed to live to be 85. Your bones are supposed to last you for those 85 years, but they don't have the same mineral content. So my number one recommendation is to not measure the bone mineral content, because you're going to flunk it. Why would you put yourself in the medical business? It makes no sense at all. So how do you decide whether or not you have osteoporosis? Well, that comes by knowing whether or not you have fractures. You say, well, that's a terrible way to make the diagnosis. If I have fractures due to very little effort, in other words, taking a big breath or somebody hugging you, you have a fracture, that's likely you got a problem. And unfortunately, that's the most reliable way to diagnose the disease and not get into trouble, is to wait until the disease appears. Just like with heart disease, wait till you get chest pain, or breast cancer, wait till you feel the lump. Don't go looking for problems, you will find them. So I do have women who have thin bones and have fractures that are due to the fact that their bone structure is not solid enough. Well, what I do for these women is the same that I do for women looking to prevent this illness, is we deal with the underlying controllable, cost-free, side effect-free factors. And those are exercise, of course, is important, not too much. Because if you get too much exercise, you can actually increase your risk of fractures by lowering your body weight and actually shutting off your ovarian function with excessive exercise, and get a lot of fractures that way. So enough exercise, which is say a walk. Sunshine is extremely important. We talked about that on 1,000 occasions. And I've told you that taking vitamin D supplements as pills or injections, I have 3 major studies, you have none. 3 major randomized controlled studies show you increase your risk of falls and fractures by taking these supplements. Don't do that. You need to get in the sun, you need to walk, and you need to not eat the diet that damages your bones. This is not a mystery as to what causes osteoporosis. Now it is if you listen to the egg, dairy, and meat industry, then everything's a mystery, because what they've done is they've given you reason to doubt. That's what industry does. It gives you reason to doubt about the damaging effects of their products. And so you can choose ice cream or pizza to keep your bones strong if you want, but it's not correct. It is a message produced by industry, and I have all the evidence to say that's true. As a matter of fact, just if I do have the screen, Gustavo, I'd like to show the book that I asked you to read for homework. And I published this in '85. I didn't show you last time, but I may show you a few more times. I have changed. So I wrote this book 30 years ago, 30 plus years ago. And we talked about cancer last week. We'll talk about atherosclerosis again, maybe next week, or heart disease or kidney disease or arthritis. You know, you read this book and you'll say, well, how do you know this 30 years ago? It's because the truth is the truth. It doesn't change. And I did a chapter on osteoporosis for you. I did a few updates. You can get this book in used bookstores, or you can also get the book by downloading it as a PDF file for a small charge on my site. You can probably get it for 50 cents at a used bookstore. This is the McDougall program for women. I updated 3 chapters on osteoporosis for you there. They say the same thing as the old book.
Right.
Yeah. And then I did a newsletter for you, and let's see, I asked you to read it, but it was in 2012. Maybe I don't let me pull it up here, but it's January 2012. So I did an update newsletter for you. So all the information is there free. And what I told you about diet is this: there is a cause of osteoporosis. Don't let them kid you that this is some mystery or some genetic deformity of people. This is a disease due to diet, and the cause of the disease has been described for over 60 years. It's based on the acid ash theory of bone loss and bone building, published many, let's say probably 60 years ago. And much research goes back even into the 20s and 30s, 19. What it is this, is when you eat the American diet, you're eating a diet that's high in protein. That's the pitch to you. Eat protein, eat eggs, eat meat, eat poultry, eat turkey, eat fish, eat dairy. This is high protein. I mean, that's the nutrient that was sold to my parents and sold to you, even though there's never been such a thing as dietary protein deficiency. Like there's never been a thing such as dietary calcium deficiency. There's no such thing. These are just unique positions that the meat and dairy and egg industry have taken to save their foods. But when you eat all this protein, what happens is the protein has to be dealt with. Say you need 20 grams a day, you eat 120 grams a day. What happens to the other 100 grams a day? It's got to go someplace. You say, well, it goes into my muscles. Well, if it went into your muscles, you'd look like Arnold Schwarzenegger or Charles Atlas.
Right.
You look like a bodybuilder. It doesn't go into your muscles, ladies and gentlemen. What happens is protein has no storage depot. There's no place to store protein. So it must be gotten rid of. And it's gotten rid of through metabolism by the liver, and then primary excretion by the kidneys. And in the process of excreting through the kidneys, all these mechanisms were worked out, and I published them 30 years ago, and they're still the same, even though there is some lying going on by the dairy industry. And you can, if you want to trace it back, studies that seem to suggest otherwise, to again give you a little doubt, so you can keep eating your, chocolate fondue, whatever. But this high protein load causes a high filtration in the kidneys. You've got to get rid of that protein, so you end up filtering a lot of protein with water and other solutes out of the kidney, and this pulls calcium out through this high protein load, which causes the excretion of everything, including calcium. There's also amino acids in protein. They're called sulfur-containing amino acids that paralyze the kidney tubules and prevent the nephrons from reabsorbing calcium. And animal protein is high not only in just proteins, it's high in sulfur-containing amino acids like methionine and cysteine. And these sulfur-containing amino acids, they break down into sulfuric acid. So the mechanisms are all worked out. Potassium-hydrogen exchange mechanisms, things I learned 50 years ago in medical school. They're all there. The research is all there. It's all consistent except for the meddling fingers of the dairy industry, which try and create doubt by doing new studies, so to speak. So you eat this protein load and you excrete your bones into the urine, into the toilet. So you pee your bones in the toilet.
Right.
And in the process, what happens is the bones, they solidify in the kidneys and give you kidney stones. So there's the cause of osteoporosis. It's a high acid animal protein diet, plain and simple, no misinformation unless you want to manipulate the science, which industry has the money to do. And all of this is published in the medicine book and in the women's book and other updated literature. See, we have our side of the literature too, which shows you the opposite of what gets published in the headlines because they have the money to do PR. And so yeah, the research is there in the contrary opinions. You just have to take the trouble to look for it. All right, so sunshine, walk, and eating a good diet, which is a starch-based diet with vegetables and fruits. You have to understand hip fractures do not occur, and you need to see this data before 1985, did not occur in countries that ate starch-based diets. There were no hip fractures in rural Africa, virtually no hip fractures in Singapore or Hong Kong or Japan, or wrist fractures. I mean, these things were rare and unknown when they lived on starch-based diets. Now, if you watch these countries or you watch people migrate from Thailand to the US or Ethiopia to the US, you see once they migrate here, they develop the same incidence of osteoporosis as whites. So it's all there. It's all uncontestable. All right, so you know how to prevent it. You know that you need to stop throwing gasoline on a fire once you get a disease. This is a reversible disease. We see people from Skylab who go up to the space station, who stay there for a year. They come back and their bone mineral density is decreased because they've lived in zero gravity situations. You bring them back, you walk them around for a while, their bones come back, the density comes back. Same thing with people who have fractures, say fractures of their arm, they're in a cast for 3 months, you take a X-ray or some other assessment of bone mineral density, it's decreased. You take the child out of the fracture, you move the arm, and the bone mineral density comes back. So bedridden people, the same thing, on and on and on. The bones regrow and heal as they should if you stop the stressors. The stressors primarily are the animal food and the acids. All right, so one last thing I'm going to go into, and you can get all this out of reading the books and the newsletter. It's basically free. So you take somebody who has terrible osteoporosis. I say they've had a fracture of the ribs or the backbone. In addition to a healthy diet, putting them out in the sunshine, absolutely crucial, and a little bit of exercise, not too much. What else can you do? Well, one thing you can do is you can feed them antacids. Remember, this is a disease due to dietary acids, so if you feed antacids to people, like Tums, for example, which is calcium carbonate, you will reverse calcium loss, not because of the calcium, but because of the carbonate. It's the alkaline nature of the antacid. It could be potassium bicarbonate, or excuse me, potassium carbonate or sodium bicarbonate, or any antacid you could use, and that would reverse the calcium loss because you neutralize the dietary acids. It has nothing to do with the cation. It's everything to do with the anion, the base part. So I will give antacids. Tums just has to be convenient. It could be, it could be any other kind of antacid. And then the next thing I'll use is estrogen. I'll use the skin creams. Estrogen always reverses bone loss and makes bones stronger. But that's a tough decision too, because you're introducing some major side effects like breast cancer and uterine cancer. So you're trying to trade off when you treat as a doctor with drugs. You're trying to trade off, and you hope that in the future you end up doing more good than harm to people. So there you go. That's my pitch on bone loss, osteoporosis, what you ought to do. Don't buy into these drug companies' ads on 60 Minutes.
Oh, yeah.
I love the ad. They show you a 30-second ad, then they show you 90 seconds of what you're going to do with your attorney in court when you get a fracture of your jaw or pneumonia or anyway.
Yes, it's almost comical to see these ads where you get, like you said, 15 seconds of the actual ad and then 30 seconds of all the horrible things that can happen to you. But it is very encouraging to hear, Dr. McDougall, that actually osteoporosis, that the bone regrowth, and that it can be reverted if you adopt a healthier diet that is not so acidic. Did I understand correctly?
Well, no, Gustavo, unfortunately, to me, what you just said kind of broken up in the words.
Okay.
Can you hear me okay?
I can hear you. I can hear you perfect. Yes. I was just saying.
Could you just,
I was just saying that it is encouraging to hear you say that bone growth can happen, and that with a good diet, the one that you suggest, it can be reversed. Is that correct? Did I understand?
That is correct. Yeah,
Okay.
just like all other systems in the body, organs, tissues, and so on, body always tries to heal. You just have to stop the stimulus of disease. Like, for example, if you quit smoking, the lungs always try and heal. If you quit half a bottle of whiskey a day, the body always tries to heal. If you stop dropping a bowling ball on your foot every day when you go bowling, the bones will heal.
Right. It's a shame that we can't get, and this is a side note, it doesn't have, I don't know why it came up, but we can't get teeth to regrowth. Why is that?
Unfortunately, Gustavo, maybe our co-producer Mary can tell us whether or not we're breaking up, or it's just with me.
Okay, let's see if let me look in here. I want to make sure that everybody can hear what I said, but if you can type on the chat box, I can hear Dr. McDougall perfectly, but I don't know about my voice.
Yeah, I'm you broken up.
Okay, could we do some quick questions?
Sure.
If you can hear me. Yeah, okay. If I just chose some that I think have a short answer to go first. Here's one. Can heavy metals such as mercury affect osteoporosis?
Oh, good question. Whether mercury can affect osteoporosis. Let me think about that. Not in my recent memory. Methyl mercury is, of course, very toxic to the kidneys and the body. But as far as some direct effect on bones, it may be there. I just not currently aware of it.
All right.
Let's see if I can think. Go ahead.
Okay. How about, well, people are saying that they can hear both of us fine, so that's good. How about being on thyroid hormones? Can that cause osteoporosis?
Yeah, good question. And it's been known for over 30 years that over-treatment of thyroid with medication causes bone loss. And likewise, people with hyperthyroidism, in other words, naturally, or not naturally, but certainly not normally, but their glands over-secrete thyroid hormone, they get bone loss, more bone loss. And so when you're treating hypothyroidism, which I do with levothyroxine, I don't use the animal gland extracts, natural thyroid, because of a whole bunch of reasons, but leave it to say that I just use the natural thyroid levothyroxine. And what I do and what other doctors do, standard therapy, is you guess based on the patient's weight what the right dose would be. And then what you need to do is follow up about 3 to 6 weeks later, get a repeat test, because it takes about 3 weeks for the levothyroxine, which is called T4, to become active. And then you check your TSH again to make sure you're not over-treating or under-treating. Yes, you need to be careful about thyroid. I do prescribe thyroid medication quite often. Yeah. Right.
I know you do. When I saw you the first time ever, about 3 years ago, my thyroid, I was not working properly. And I remember you prescribing something. I decided to wait a few months, and I don't know what happened, but it was reverted. So now my thyroid function is normal, which, food, like you said, it's the food.
Yeah, it's the food. I can just tell you an observation, which is we've not published. But on average, I would guess from what I've seen is the TSH levels when we repeat them. That's the thyroid stimulated hormone, which reflects thyroid function. They improve by about a point. Mm-hmm. I don't know why, in 7 days. And I certainly would not put that out as a confirmed benefit or a reason to follow the diet. But that's kind of what we see in 7 days when we check them initially, and then we check them 7 days later. Maybe someday Dr. Lim or somebody will publish those results.
Right, right. Very interesting. Another question, short answer, I think, is given that it is an acid, is there any osteoporosis risk from vinegar?
Oh, really, really good question. I mean, a better question than I even could invent 30 years ago and should have put more clearly in the book. But I have written it other places. Is people come to me and they say, well, look, lemons and other citrus fruit, they're acidic. Mm-hmm. And so they probably cause bone loss. Well, they're acidic if you take a pH stick and you measure the juice. Then you get an acid response from the citric acid or other types of natural acids in there. But the lemon or the orange or the grapefruit itself is overall not acidic. If you take the whole fruit and you blend it, chew it up, and then some other way digest it, then what happens is it delivers an alkaline load. In other words, the juice may have a little acid in it, but when you measure what happens with pulp and the proteins and all the things that are in a lemon or an orange, you find out that it doesn't deliver an acid load, it delivers an alkaline load. So they're good for the bones. And don't get fooled. Many dietitians get fooled, and other people, they go, oh, well, if you're saying acid causes bone loss, then we have to stay away from lemons and grapefruits. That's wrong thinking. And I hope I've made it clear as to why it's wrong thinking.
Right. But now lemons and let's say, like you say, but that's one thing. But to me, vinegar is a different thing, or is it the same? I mean,
well, vinegar is just a weak acid. You're right. You wouldn't, if you just had pure vinegar, you wouldn't deliver their alkaline parts to the system. So yes, you could make a case that vinegar is just giving pure acid, but it's not that much acid. Not
that much. Right. Okay. Okay. How about excess sodium from table salt? Does that contribute in any way to osteoporosis?
Well, it has. There's some evidence that sodium adversely affects calcium balance, but I don't think it's the major thing. Clearly, the problem is not the bacon, it's the pig. It's not the salt that gives you heart disease when you eat bacon. Right. It's the pig. The only reason you put the pig down is because it's loaded with sodium. Otherwise, the pig would be too disgusting to eat.
Yeah.
Which was very interesting. Did you hear Friday night's lecture last week?
Right. At the advanced study weekend?
Yeah.
Yeah.
Sure.
Oh, yeah.
By Jeff Nelson.
Right. Jeff
Nelson. Armor Food Company.
That's right. That's right. I didn't know that his family was.
Yeah. Jeff Nelson on Friday night, the advanced study weekend, any of you that saw it or are going to watch it, because you can still watch it. Jeff Nelson, very good, long time friend of mine. I learned things about him on Friday night that I never knew. But what he told us Friday night is he is the great-great-grandson of the people who founded Armor Food Company. And in that hour-long presentation, he basically told us that his great-great-grandparents, or maybe it's great-great-great-grandparents, destroyed the United States of America and the world by making what do they call it, a pork barrel, making it available so that every American, and now it's every Chinaman, every Indian, everybody in the world, Armor, and in other words, his lineage, his family, made it so that everybody in the world can and does live on meat.
Right.
phenomenal presentation. And I'm sure Jeff gave it to us, told us with some embarrassment and shame and responsibility, because if you listen to the presentation, Jeff Nelson, who again is a very close friend and a very strong advocate of a healthy diet, including a vegan diet. Jeff told us how this happened 150 years ago. Yeah.
Right. Well, he has a big load to carry, and now he has to redeem himself. Dr. McDougall, can a 91-year-old correct osteoporosis, or is it degenerative, maybe cause too much damage? Can the let's see, whole food plant-based diet still going on to help at this age? That's what this person is writing.
Okay, could you just give me the question really short?
Yeah, let me read it again. Can a 91-year-old person, I don't know if it's a man or a woman, correct osteoporosis, or is the damage that is already done too much to correct it with a plant-based diet?
Great question. The body, it never stops healing. I think 91 years old is plenty old enough. You know, if you give me my personal opinion, if you could get, I'm almost 70. If you could give me a piece of paper that says, John, I guarantee you'll die at 90, I'd sign it.
Mm-hmm.
You know, yeah, that's a long time to live, but the body never stops trying to heal. We have people in our clinic who are sometimes over 90. We've had maybe 1 or 2 this year, and they do improve. But no, you're really looking past the end of a normal human life. Many of you will never tune in here again, but Dr. McDougall is not here to offer you a magic pill that will cause you to live to be 110.
Right.
Even if I could, I don't think I will. The normal lifespan of a human being is 85 years. I had a grandmother who lived to be 106. She told me it wasn't worth it after 90.
Really?
I have a mother who's 92. Yeah, I have a mother who's 92 who I assure you, she's had a full life. So, yeah, 91, I'm happy you're still going and still trying, and the body will still heal, absolutely. But you should just kind of pat yourself on the back and say, I beat the odds.
Right. We know from what you said a few minutes ago that the main cause, of course, is diet and maybe lack of sun or exercise. But does coffee or caffeine or alcohol have any big impact, or should people not really worry about that?
Yes, there is research, and I may have put it in one of these books, or I may not have, but there is some research dating back that says coffee has a negative effect on the bones. And there is research, by the way, that says alcohol has both negative and positive effects. But I think it's kind of interesting that alcohol, in my memory of the research, has a positive effect on the health of the bones. Now, why would this be? Why would alcohol have a positive effect? For one thing, it is the ultimate no fat, low protein, low acid food. You know, so when you're drinking the booze, you're not taking in the animal protein. The other thing that may have a positive impact is that whatever causes you to gain weight, and not severe alcoholics. Severe alcoholics are very thin, but sociable alcoholics, moderate drinkers, are often quite fat because they lose their inhibitions and they drink alcohol and can't have 1 potato chip, they have 2 bags. So whatever makes you fat increases your estrogen production, because your body fat cells make estrogen. So that means that extra estrogen will influence your breasts, more breast cancer, your uterus, more uterine cancer, more gallbladder disease. But that extra estrogen will also, at the same time increasing your risk of breast cancer, reduces your risk of bone fractures by similar estrogen-based mechanisms. So your question is, will alcohol cause you to have stronger or weaker bones? Probably stronger, for the mechanisms that I said. It's protein acid-free,
right,
and it causes you to gain weight. But is alcohol health food? Oh, come on.
Yeah.
Don't twist my words to make a trap for fools.
We
And
just
people
want
try
you
to-
to, yeah, to say that it is okay. Well,
Yeah, you want me to say it's okay to eat
we
chocolate,
want you to say that it's
bacon, and hot dog sandwiches, and to drink booze. You want me to say that, don't you?
right.
And
No,
coffee, of
no,
course.
and coffee, yeah. So, by the way, what are you drinking, Dr. McDougall? Is that tea?
I it was just like I never say which Thanksgiving I have turkey at. I never tell you what's in this cup.
Right. So,
Or whether or
we'll
not
have to
this is
just
vodka,
wonder.
whether or not this is vodka or water.
Yeah, who knows what it is?
Who knows?
Well,
or whether or not I have a tattoo on my chest that says "Do not count." I
that's
will see
right.
it.
That's, Dr. McDougall, I
In
see
other
some
words, Gustavo,
questions.
what I do is unimportant to what you do. You just need to hear the truth.
Exactly. It's just your own business.
Yeah, and you know what? I think for almost 70, I'm doing pretty good. I do think I caused a little stir on the stage last weekend. People did not think I was.
Did.
People did not think I was meek or weak.
Right. And I have to say, because people every now and then comment on the quality of the video. I'm sorry again to say we don't have a studio set up, so sometimes the lights do create some shades in Dr. McDougall's face or in my face, but I can testify by seeing Dr. McDougall this weekend that he looks great, and at nothing like he's even close to being 70. So until we get a studio lighting, we're just gonna have to.
Well, thank you, Gustavo. It's always good to hear, you know, that from other people. Not only that I'm doing okay and Mary's doing okay, but we always love to hear that you're doing okay. And people, that weekend we must have had 250 people there, and there probably a third of them came up to me and said, "Oh, I'm sure you're tired of hearing this, but I just wanted to tell you what happened to me." And you and I, Gustavo, never get tired of hearing we helped.
Oh, no, not at all. It's always so comforting. I see a lot of questions that people are typing, but these questions, 90% of them are already answered in the reading that we sent you all. So make sure you check your emails, because you have access to Dr. McDougall's book for free. We're sending you the file with the chapter on osteoporosis. So I highly recommend that you all read that with the newsletters. Dr. McDougall, I think we're getting close to finishing today.
Oh, good. Okay.
But can you just comment quickly on, there's some question about calcium supplements. And of course, you just said basically no. But did you ever find any case in which you would have considered giving a calcium supplement?
Oh, yes. As I mentioned, if we get to the point where I have a definitive diagnosis of osteoporosis based on, say, wrist fractures, rib fractures, and I look at this person, and this is a clinical assessment, by the way. This is where a doctor has to sit down with a patient and guess. You can use a bone mineral density test to help you with that assessment. But that's not the definitive diagnosis. It may be in the drug company's minds, but the diagnosis is based upon clinical judgment. And if I think a woman, which it usually is, it could be a man, has significant fragile bones, significant weak bones, and I need to pull out all stops in terms of being a doctor. You know, I'm a real doctor. I am licensed in 5 states.
Right.
And I have a prescription pad, yeah. What I will do, at first my effort, just like with heart disease and breast cancer and constipation, is to get people to fix the problem, which is the food. And I worry about recommending anything in addition, like statins for heart disease. I really got questioned about using aspirin this past weekend for heart disease.
Right.
So I really get concerned about telling people about using medications that it will some way lessen their resolve to eat well. So if somebody's sitting there with heart disease, they'll say, well, you know, I can have this extra egg. I'll just take an extra Lipitor. Or if somebody says, well, I have weak bones, I really don't have to get out and get the sun, or we'll go for a walk, or, you know, eat a diet of alkaline foods, especially potatoes and sweet potatoes. which are really very alkaline. Grains and legumes are slightly acidic, but not so bad. Don't get fooled into that grains and beans are acidic argument. They're 10 times less acidic than cheese. So I can't get people to kind of buy into my whole message, or they need a little bit more. And medicine does have some positive things to offer. They're always associated with negative. In other words, there's always adverse effects. When there are effects, there's beneficial and adverse. So you sit down and you start doing your guessing as a doctor, and you say, well, let's see, guess. You know, we got them sunshine walking, and we got the good food part as well as we can. They're living in a assisted living facility, a nursing home, and so they don't have very much control of the food. I realize that. So what else do I do? Well, the second thing would be to add a couple of Tums a day for the acid effect, not for the calcium effect.
Right.
And then the last thing I would do is put them on some topical estrogen progesterone creams. And that's the way I would approach the problem. I would never use bisphosphonates, you know, like Fosamax. And anyway, there are a whole bunch of Actonel, Fosamax, Boniva. You know, I can't keep up with the names of these bisphosphonates, which are supposed to fix your bones, or nor can I keep up with the studies that show how dangerous they are. So I never use those.
You would never use.
You can find lots of doctors that do.
All right, and you would never consider using injections like the Prolia or anything like that.
But I don't do it.
Okay.
I mean, it's just not part of my practice. Are there benefits? Yeah. Are there costs? Are there risks? Yes. But you won't find those recommendations coming from me. Why? Well, you know, that's not where my experience lies, for one thing. Some of those drugs are too new for an old doc like me. But I do read about the benefits and risks, and I assure you the benefits are minimal. The costs are huge. You would never be able to afford it if it wasn't for your insurance. And the adverse effects vary with the drug, but they're always there.
Right, right.
So, you know, you decide. Clearly, I can recommend cost-free, side effect-free approaches, which I always do. Go for a walk, a little sunshine, and eat a starch-based diet. No hesitation there. I can add a little antacid, a little estrogen, and sleep at night okay. But I can't do those other drugs. You can find lots of doctors who can. They have the sales reps in their offices, which of course, Gustavo, I've told you I miss.
Right.
Yeah, you know, those gorgeous ex-cheerleaders.
Right.
Tough life. Maybe sitting there feeling so far sorry for John. He doesn't get entertained by the beautiful young drug reps. That's the life of a diet doctor. My office staff doesn't get the pizza and donuts that are brought in or taken out to lunch by the drug companies. So we live a tough life we do here at the McDougall program.
Oh, very tough. I can see that. Dr. McDougall, for the vitamin D, we did a while back, we did a webinar where you talk extensively about vitamin D. So those of you that are asking more questions about that, I highly recommend you go back to the website and look for that webinar on vitamin D. But just tell us in a sense, how long do you recommend someone to be in the sun?
Well, it depends on how dark they are. Somebody really light like myself, that has to be in maybe 5 minutes. 5 minutes at noon, 3 times a week. It'll be enough on my hands and face. That's plenty. You're a little darker than I am, Gustavo, so you have to maybe be a little bit. And then there are Asians with a more dark skin color and blacks with a very dark skin color. So it depends on your skin tone, how much clothes you wear, what the latitude is you're living at. Depends on a lot of things, but in general, I would say if you want to know when you had enough sun, it's when the skin starts to turn red slightly. Right. Then you've had plenty, and I think that'd be a good gauge as to how much you should be getting. Mary and I are sun worshipers, but I don't get sun on my face anymore because I lived on a sailboat for 3 years, basically lived on a sailboat and burnt my lily white skin to death in Hawaii. So I'm very careful, and you may be in the same situation. You may have burnt your hands or your face. So wear a hat to expose your legs or your belly or whatever. You've got areas that have not seen enough sun.
Right.
And you do need sunshine.
Right. Well, great, great. Thank you. Everybody is saying how much they have enjoyed this time with you.
Oh, good.
And I learned a lot. Go back, everybody, and read the material. It's just wonderful information that Dr. McDougall is sharing with you for entirely free. And thank you again, Dr. McDougall, for joining us.
It was my pleasure. And thank you for coming all the way out to our advanced study week in Gustavo. I know it was a big trip.
It is long, but it was yeah, it's totally worth it. Totally. So
everybody loved being with you. And
yeah,
I do want to mention you're going to be in Kauai.
Yes, so exciting! My first time.
Yeah, it'll be fun. The grandkids are going to be there too. We're going to go boogie boarding.
Your grandkids. Yeah, your grandkids. They look so healthy, so good. It's a true. It's a way to show that a starch-based, plant-based diet is perfectly fine.
We had 4 from 2 different families there this past weekend.
Right.
And they will be there in Kauai, and you'll also that's the one time you'll get to see my tattoo.
That's right.
That's right. If you want to see my tattoo, do not calf. I will sue.
You've got to join us.
It will be exposed in Kauai at the end of January on the beach. We'll all get together.
And no photos allowed, right?
Yeah, I don't know. Maybe I'll do photo ops too. You can send it to friends.
Right. Okay.
Certainly, it will be a good time for all.
Oh yeah, it's going to be a great time.
It's not that we're sitting idle. We've got a program in December where the general public can come, but we have the McDougall team has 2 programs we're running with almost 100 people each over the next several weeks for corporations.
Right.
So if you notice, in addition to the presidential candidates, which we're happy to give a special program for, if you know companies that need to make an extra 2, 3, 4, or 5% profit by not paying any longer for sick employees, we do that. Yeah, we just have a whole bunch of things that we have to offer the world in a positive way.
Right. Well, you do certainly keep busy, so we appreciate
Thank you. Thank you. Thanks for your help, Gustavo.
All right. Well, we'll see you next week with another great topic. I think it's atherosclerosis for next week. And
that'll be good. Maybe we could get David Blankenhorn out.
That would be.
I could show he was one of the early pioneers, and we'll talk to Dean Ornation. We'll have a lot of good things to talk about next week. We'll talk about artery disease, and if you have the time, you're a professional or just a very interested person, take the trouble to read the things that I've written, 30, 40 years ago for you. They haven't changed. I'm very proud of this is one of my favorite books. A picture again.
It is. I know. Very good. Well, these webinars are a sort of informal chat, and I know every now and then someone complains a little that we deviate from the main topic, but we come back. There are many other webinars that are on the same topic, so if we didn't cover your question today, we will later on. But we like to visit too.
Our goal is entertainment.
Right.
We're
entertainment with good information.
Yeah, you know about the entertainment.
I do. With my fingers. Yeah.
If we put on a good show, they'll come back.
Exactly. All right. Well, goodbye, everyone.
Have a good week, and everything's free.
Very good.
Very much. Bye-bye.
Very good. Okay, Dr. McDougall, goodbye.